If you're concerned about preventing or minimizing the signs of aging like hyperpigmentation, fine lines, wrinkles, saggy skin, etc., then this video is for you. I'm going to be sharing 10 dermatologist approved tips to follow. Hi, if you're new to the channel, welcome. I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California. I'm here to help you understand your skin and find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. Before we delve into these anti-aging tips, I do want to take a second to talk about the term anti-aging because I feel like it gives all of us like a little bit of an ick. And it's because we are actually pro-aging. We want to be getting older and to live these long, healthy, happy lives, but we don't necessarily want our appearance to reflect the fact that we are having more birthdays. And yes, that somewhat comes from societal pressure to look youthful, but what I find as a cosmetic dermatologist and from patients who are coming into my practice seeking anti-aging treatments or anti-aging advice is that they are finding this disconnect between how youthful and vibrant and vital they feel versus how they look. So it's a much more internally driven motivation than I ever realized because patients are looking at themselves in the mirror feeling like they are still in their 20s or in their 30s, but looking back at them is someone in their 50s or 60s. And that can really mess with your psyche. So the reason I'm giving these anti-aging tips is so that there can be more harmony between how you look and how you feel. And I'm not telling you that you have to look younger, that you have to take this anti-aging advice. If you are happy with your appearance, if you're okay with looking older, that is totally fine. But for people who are looking to optimize the aging process, at least from a cosmetic standpoint, then this video is for you, no matter what your motivations may be. So let's get into the tips. Anti-aging tip number 1 should be absolutely no surprise to you, and it's to wear sunscreen. I kind of feel like if you are watching this video and you're on my channel, you already understand the value of sunscreen and the importance of wearing sunscreen pretty much every single day. But I find that in my practice, when I'm talking to patients about their sun protective habits, a lot of them are not wearing sunscreen regularly, or they say, oh yeah, when I'm outside, when I'm doing outdoor activities, when I'm on the boat or whatever. But the reality is it's all of these little incidental sun exposures over your day, whether that's like walking to the car or getting groceries or picking your kid up at school and standing outside in the pickup line for 10 or 15 minutes. All of that sun exposure adds up over your lifetime and can contribute to premature skin aging. When your skin is repeatedly exposed to UV radiation emitted by the sun, it damages the structural support proteins within your skin and it damages the DNA, which affects your skin's ability to renew and regenerate itself optimally. UV radiation also turns on certain pathways within the skin that lead to excessive pigment formation as well as inflammation within the skin. So that's what's happening microscopically to skin repeatedly exposed to UV radiation. Macroscopically, or what the skin looks like to the naked eye, is increased sallowness, dullness, texture, fine lines, wrinkles, skin laxity, irregular pigmentation formation, all essentially signs of premature skin aging. Depending on what study you're looking at, somewhere between 80 and 90% of skin aging is due to UV radiation exposure. There's this photo of a truck driver that went viral a little while ago because what it shows is that this person who spent most of their life as a truck driver has extreme aging on one half of their face and the other side just looks like normal aging. And that's because that extremely aged side was the driver's side window that was chronically exposed to UV radiation. And I feel like this really illustrates the power of sun in terms of affecting how your skin ages. So that is a variable that we have a good degree of control over. I'm not saying you need to eliminate all sun exposure. That's not reasonable. That's no way to live. But if you just limit it with UV protection, whether that's sunscreen or UV protective clothing, which we'll get to in a second, you can greatly influence how your skin ages. And daily application of sunscreen is not just about preventing signs of premature skin aging. It has also been shown to reverse signs of skin aging. So there's a pretty famous sunscreen study in which people were asked to wear sunscreen every day for a year. And those people showed improvement in clarity and texture, so signs of premature skin aging, by wearing sunscreen. So if you didn't wear sunscreen when you were younger and you feel like, oh, there's no point in doing it now, all the damage has been done, false. You can still reverse some signs of skin aging by picking up that daily sunscreen habit now. I recommend getting in the habit of putting on sunscreen every single morning. You might not need that protection every single day because you're staying inside and you're not near windows, or it's rainy or super cloudy outside and your UV exposure is pretty minimal. But if you put it on every single day and you make it your habit, then you will always be protected and you never really have to worry about it. And then of course, if you're spending time outdoors or you're sweating or you're doing other activities, then you can reapply. But just getting that initial coat of sunscreen on in the morning will change how your skin ages for the better. If you haven't found a sunscreen that you love yet, don't be discouraged. Sometimes you have to kiss a few frogs or try a few sunscreens before you find one that you love. I have lots of videos here on YouTube that talk about my personal favorites, so maybe you want to try one of those. A lot of times I get the question, well, what's the best sunscreen? And what I will say, and what lots of dermatologists will say, is the best sunscreen is the one that you will wear repeatedly and be motivated to use. So ideally, I like something that's SPF 30 or higher, something that's broad spectrum, but beyond that, it's totally up to you and your preferences. My second anti-aging tip is to not just rely on sunscreen for your UV protection. That's right, out of the 10 tips that I'm giving today on anti-aging skin and skincare, 2 of them revolve around protecting yourself from the sun. That's how much UV radiation influences skin aging. Sunscreen's great, but it's not perfect, and it's just one part of a sun protective regimen. Australia has their Slip, Slop, Slap, Seek, Slide campaign, which I think is an amazing way to remind yourself of all the ways you can protect from the sun. So that stands for slip into UV protective clothing, slop on SPF 30 or higher sunscreen, slap on a wide brim hat, seek shade, and slide on sunglasses. It might not be feasible for you to do all of these things every single time you're spending time outdoors, but if you get in the habit of incorporating more of these sun protective methods into your daily routine, the better off your skin will be in the long run. Tip number 3 is to start incorporating a topical retinoid in your face and body skincare routine. Retinoids are a category of skincare ingredients. So under that category falls ingredients like retinol, retinaldehyde, which you can find in over-the-counter products, as well as prescription strength retinoids like tretinoin and tazarotene. I have a bajillion videos here on YouTube that talk more about retinoids and their benefits, as well as give retinoid product recommendations. But the gist of what retinoids can do for your skin from an anti-aging perspective is that they increase collagen formation and decrease collagen breakdown. That leads to thicker, stronger, healthier appearing skin with fewer fine lines and wrinkles. Retinoids also increase the rate of cellular turnover within the skin, which help with things like dullness, sallowness, as well as correcting irregular pigmentation. I can tell you that even if I have never met someone before, I can often tell if they use a retinoid in their skincare routine because their skin has this beautiful glow and vibrancy that is very hard to achieve with any other type of skincare ingredient. I feel like a lot of people are really good at using a topical retinoid on their face, and maybe they're even extra and use it on their neck and chest and hands. Beautiful, but not as many people are using retinoids in their body care. But anti-aging isn't just about your facial skin. And although your face is what you're looking at every single day, what I find is that as people age, they start to get concerned about other areas on their body. They start to notice crepey skin or sagging skin on their arms or on their legs, especially when you get to be perimenopausal or even postmenopausal and you don't have those positive effects of estrogen in the skin. And that's where a retinol body cream can be extra helpful. I have not spoken as much about retinol or retinoid products for the body. The one that I've been using the most lately is by Naturium, and I am on the Naturium advisory board, but I think that this makes my skin just feel so good. It's kind of like a mid-weight lotion, so it's not like a full-on body butter or body cream, but it still has a very hydrating, nourishing effect. So if you're looking to kind of up your retinoid game and increase it to not just a facial application, but to an entire body application, might be worth a shot. Anti-aging tip number 4 is to consider having in-office treatments. As a cosmetic dermatologist, this is what I do. And I feel like sometimes people are looking for anti-aging advice that they can do at home on their own. And that's totally fine, but I think it would be a huge disservice to give the illusion that you can achieve all of the anti-aging things that you want to achieve just with good skincare and lifestyle changes. Those are, of course, extremely important and serve their role, but there are some things that you just need a little more technology to achieve, and that can really only be done in the office by a professional. And when it comes to in-office procedures, there's such a huge range. There's injectables like Botox and fillers that we use to help with fine lines and wrinkles and some restructuring of the face. There's surgical interventions like facelifts and eyelid surgery and fat grafting. There's skin resurfacing procedures like lasers and radiofrequency microneedling and chemical peels, and they each do something a little bit different. The world of cosmetic dermatology and plastic surgery can be really overwhelming, and a lot of times people ask, well, what's the best? And I'm very clear with my patients when I say there is no best. When we age in different ways, and we age in different planes of the face, meaning that our skin ages, our muscles age, our fat layer changes, our bony structure changes. And so depending on how your face is aging, that might require interventions with multiple different modalities to achieve the most balanced and harmonious result. I think some people are hesitant to pursue cosmetic interventions to address their aging concerns because they see in their day-to-day life people who look unnatural, or they see that in celebrity culture or pop culture. But the reality is there are lots of people who walk among us who've had amazing work done, and you just can't tell. If it's good work, you don't see it. When you see someone who looks a little bit distorted or overdone, a lot of times it's because they've leaned too heavily into one or two types of interventions. So for example, maybe they've done a lot of filler when in reality they also needed to be focusing on tissue tightening and skin resurfacing. I say this because if you're considering some type of cosmetic intervention, the first thing you're going to do is have a cosmetic consultation. And it can be really hard to choose a cosmetic provider and to figure out who's going to treat you and how. But in that cosmetic consultation, I always ask people to look for, what are they offering you? Are they just offering you Botox and fillers? What do they have access to? Do they have access to laser resurfacing? Do they refer people out to surgery if that's truly what's needed? And the more comprehensive someone's training is, what tools they have access to, what other doctors they are connected to and can bring into their network to help a patient, usually the better your outcomes are going to be. Also keep in mind that if you're doing cosmetic interventions, you don't have to do a lot all at once. You can do little tweaks periodically. And I often find that patients who age the most gracefully with a little bit of assistance are often doing things frequently, but not doing a lot with each intervention. This also, of course, will have to do with your unique aging situation and how old you are. So for example, I'm in my 30s, I have a lot of sun damage growing up. My anti-aging regimen involves getting Botox a few times a year to help with the lines that like to form between my brows and around my eyes and on my forehead, as well as doing some light laser resurfacing a few times a year to just help with collagen formation and evening out my skin tone. For someone who's in their 40s or 50s or 60s, their anti-aging regimen in terms of procedures might look a little bit different. They might be doing Botox with the same regularity, but maybe they've added filler a couple times a year. Maybe they get a facelift and then they start doing other things like lasers and skin resurfacing afterward to maintain those results. So it's really different for each person, and it's so important to have a plan that's really tailored to you and your skin and your face and your goals. Okay, tip number 5. Be mindful of certain repeated movements that you make with your face that can lead to premature wrinkling. For example, do you always find that when you are on a Zoom call or reading something critically, you scowl and furrow your brow and these little lines between your brows start to form? Or when you are outside, do you squint into the sun because that can cause premature formation of crow's feet? Or do you drink out of a straw on a regular basis? Because that can cause vertical lip lines. And let me tell you, that's one of the biggest complaints I have from women who are 40 and above. Another common place this will show up is on the neck as horizontal necklines from looking down when we're reading or on our phones or whatever, or sleeping even on our sides and we tuck our chin, that can cause these horizontal bands. And it's very hard to prevent all of this, right? Like, we have to live our lives and we can't always be thinking, well, how is this going to affect my aging? That is no way to live. But if you are more cognizant of these repeated muscle movements and you can reduce them in a way that makes sense to integrate into your lifestyle, that will help your face or your neck or whatever body part you're focusing on age a little more gracefully. And in some of these areas, you can actually get Botox to help with that. So if you are a chronic brow furrower, a lot of patients will start getting Botox here just to prevent those lines from ever getting really deep, because no matter how hard they try, that is such a deep habit ingrained within them that they can't do it without a little help. Or you can get Botox a little bit around the mouth to just soften that pursing motion that you make with your lips, so those lip lines are less likely to form over time. There's no perfect solution for this, but if we are mindful of it and if we intervene upon it, it will help. Tip number 6, if you have female or male pattern hair loss, intervene sooner rather than later, because a full head of hair is a sign of youth. Also, having pigment in your hair is a sign of youth. So we know that as we get older, our hair goes from pigmented to gray, and that happens on a different timeline depending on your genetics and some other physiologic factors, as well as maybe some medications and other lifestyle choices that you may make. Now, this is all to say that if you were to strive for a full non-gray head of hair, you might have the most youthful appearance. But this is also to say that If going gray doesn't bother you or having thinner hair doesn't bother you, you don't have to do anything. I'm not here to tell you that you must address these things, but if you're trying to do the most when it comes to anti-aging, those are two things you could intervene upon. If you're interested in addressing your hair loss, I have lots of videos here on YouTube that give more details on hair loss and how to intervene upon it. Something that's really important to note though, if you're dealing with male pattern or female pattern hair loss, is that this is a chronic, ongoing condition. So if you decide to do something about it, for example, introduce minoxidil or Rogaine to your routine on a daily basis, you will have to continue to use it daily in order to keep those results. Don't shoot the messenger on that one, but it's important to understand what you're getting yourself into. The same way that if you are exercising and you get some muscle mass that you're excited about, you're going to need to continue to exercise to maintain that muscle mass. If you're growing your hair back and you are doing some type of intervention for that and you're happy with it, you will need to continue that intervention to maintain that result. Tip number 7, get adequate sleep. So much easier said than done, especially as a new mom. I completely understand this, that even if you might want to sleep more, you might not be able to because of certain things going on in your life or with your body. But the more that you can get the rest and the sleep that your body needs, the healthier your skin is going to be and the younger you're going to look. There are many studies that show how lack of sleep and tiredness negatively impact our appearance, including a study that shows that diminished sleep also decreases the efficacy of our skin barrier. Tip number 8 is to eat whole foods and to limit your intake of processed foods. Dietary science and how what you eat affects how your skin looks or feels or acts is tricky because there are a lot of variables in that equation that affect the ultimate outcome. Something that never really seems to go out of style, although, there will always be haters, is eating lots of fruits and vegetables, especially ones that are brightly colored that are rich in antioxidants, because those have been shown to make the skin more resilient and have anti-inflammatory effects. There's also some data to show that if you have a diet or a medical condition such as diabetes that leads to higher sugar levels in your tissues, that sugar can bind to the collagen molecules in your skin and make them more rigid and more fragile. Now, does that mean you need to eat a diet low in sugar? Not necessarily. That process is much more complicated than making that small tweak in your diet, but it does show that there are certain things that we want to at least be aware of and keep an eye on the data for. The other thing I want to recommend is that when patients ask me about eating for skin health, what I tell them is you really should be eating for full body health. When you are eating for the health of your brain and your gut and your liver, the health of your skin will follow. For me, I found that what works best is eating mostly plant-based, although I love chocolate and cheese, and to limit my intake of processed foods like breads and cakes and cookies. But again, dessert is an essential for me. So it's all about balance, right? I'm not just going to eat to be healthy, I'm going to eat for pleasure too. And it's always important to find what balance works for you in your life. Tip number 9 for anti-aging, don't smoke and ideally don't drink alcohol either. There are numerous studies that demonstrate the negative impact on our skin that smoking has because of the way smoking affects collagen within our skin. It leads to things like fine lines and wrinkles and skin sag. Now, the connection between alcohol and how our skin ages is way less explored, but the World Health Organization just put out a statement saying that no amount of alcohol is considered safe or healthy, so I'm taking that pretty seriously. And anti-aging tip number 10 is to wear compression socks. This is particularly true if spider veins or varicose veins run in your family, but those are things that age the appearance of your legs. And there's sort of things you don't think about until they show up on your skin, and then they are much harder to treat. So the more preventative you can be, which is what compression socks do, is they put a little hug or squeeze on the blood vessels in your legs to prevent them from dilating or popping up on the surface of your skin, the better your legs are going to look in the long term. I would say that if you have a job where you are on your feet a lot, for example, nursing, working in retail, working in food service, then wearing compression socks as much as possible is going to be helpful, because when you're standing, that's when the effects of gravity really take a toll on the veins and vessels in your lower legs. Also, if you are pregnant, this is a great time to be wearing compression stockings. We see tons of varicose veins and spider veins pop up after pregnancy because your belly is essentially inhibiting the ability from blood to return from your legs back up to your heart. So the vessels in your legs get sort of distended, which causes them to become more prominent. In a perfect world, you'd wear at least knee-high compression socks every single day. That's not feasible for everyone. That's certainly not fashionable for everyone, but I wear them every day that I'm in clinic where I'm wearing scrubs because no one can see them, and it's just an easy way for me to be proactive about how the skin on my legs is going to age and also how my legs are going to feel, because compression socks also help with things like leg fatigue. The brand Bombas makes some of my absolute favorite compression socks. They're mostly knee-high. Could you wear thigh-high compression socks? Yes, and if you are, oh my gosh, you're an overachiever, do it, do it, do it. But I would say knee-high is generally enough for most people. I also like a brand called Pro Compression, so they also make really nice compression stockings, but it's about consistency. So sure, you can wear them on long haul flights or long car rides, and they're going to have some benefit, and really the benefit there is to prevent a deep vein thrombosis or a blood clot. But if you want to prevent spider veins and varicose veins as much as possible and kind of fight your genetics a little bit, then wearing compression socks regularly is really going to help. All right, those are all the anti-aging tips I have for you today. I feel like I have a few more anti-aging tips up my sleeve, so maybe we'll do a part 2 of this video. Do you have any anti-aging tips? Put them in the comments below. As always, thank you so much for watching. Don't forget to like this video and to subscribe to the channel, and I'll see you next time.